11th year of our conference that always occurs on EMS Week. It kicks off our EMS Week celebration at OhioHealth. So we have a number of things in our exhibit hall. What we're standing in front of right now is one of our simulation setups. Specifically, we are dealing with a trauma scene, the movement of a trauma patient, ultimately into a recreated trauma bay here for learning, education, some experiences, just some sharing of information with our EMS providers. It's actually one of 3 experiences we have. We have a trauma bay, we have a cath lab, and we have a neuro intervention suite simulated here today with patient movement, with patient interventions, with the opportunity for our providers to kind of see what we do and also interact with the specialists who do that, ask any questions that they have, and just build that rapport and that knowledge and that relationship. We want them to be comfortable with what we're doing to care for their patients. We want them to be comfortable with the procedures, and we want the opportunity for any exchange of information, any questions they may have, anything that we can do to help make their job easier.
So what's really cool about these mannequins is how responsive they are. So they have a pulse, they'll have a deflated lung sound, or they'll have, different areas, injuries that we can look at and really see and visualize and touch and feel, as opposed to just saying, pretend like their arm is broken, or pretend like you can't hear this lung, or whatever. So it is very helpful to the guys.
It's always important to be able to have as realistic as approach as possible to be able to practice and be part of what they do on a daily basis. When you get out there in the trenches and you're doing your work, it's not the time to try to think about how we're going to train and practice. And so to be able to go through some of these things on a daily basis for stroke and STEMI and trauma is very important to all of the providers.